guess this is the right image for a dentist, one with full pocket. Am I audible enough? Okay. All right, my name is Marvin Choma. I'm a dentist. Luckily, I qualified at this very university in 2010. Currently, I'm in a developmental post in the Department of Orthodontics under the leadership of Professor Dauji. He's a very wonderful man. I did my ComServe in 2011, obviously, and then 2012. I was thrown into the deep end. I had to go to a very rural hospital, and I got there and I became the head of my department in dentistry. So it was quite a lot of experience in a short time. Over and above that, for 2014, I am a member of the executive committee in the South African Dental Association, SADA, as you would have it there. So it's quite a lot of experience that I've had so far, and as you can well see, I'm still very young. I can still actually remember when I was at your position as a student or a learner in high school. I came from a very, conservative background. I was a learner in Khomotso Comprehensive High, which is in Soshanguve, just north of Pretoria, and I didn't really deem myself much to be the kind of material that University of Pretoria wanted. And then, God willing, I came here, and the first thing that I was told is that choosing the University of Pretoria is choosing the best. And I didn't understand, because obviously they don't have the sea and the nice Table Mountain, which is one of the universities I applied to. But then after a long conversation with my parents, they decided, no, come to the University of Pretoria. And I think that was probably the best decision that I've made so far, because when I got here, I learned that it really doesn't matter where you come from, your background or what. What matters is what you want, okay? And I still want big things. So I will just phrase here Nelson Mandela. I'll quote him. He says here, "There's no passion to be found in settling for a life that is less than the one you are capable of living." And for me, that means everything that I've gone through, because right through from first year up to now, there's been a lot of struggles, but I've been through them all. Simply because I wanted what I wanted. I did not want anything less. I did apply with my grade 11 marks. I got provisionally accepted at all the universities in South Africa. And then, unfortunately, I missed the July test that they just told you about. And I got second rounded for electrical engineering, and I didn't want it. I chose to take a gap year. There was a program then called the University of Pretoria Foundation Year Program. I did that for a year, and I reapplied, and I got accepted. That's how serious I wanted it. Since then, we came as a full group of first years, and we sat in this very lecture room. And they told us that, look at your neighbor on either side. Note one thing about them is that each and every one of you here have been handpicked. And if you look at our class, our dentistry classes are very small. We consist of about, at most, 68 students. At most. The current third year group, I think, is about 48. So as you walk through it, you actually start to believe, and it's really true, that you were handpicked. So I'm very proud to be a dentist. Cut the long story short, I graduated 2010. Just to show the quality of academic that they make out of you, is that when I was in ComServe, obviously I encountered a lot of other dentists from other universities, and my work ethic already was a lot higher than theirs. My clinical skill was a lot higher than theirs. The very first patient I saw, this gentleman came in and he just had a normal toothache. So I took history and everything, and then immediately upon history taking, I realized that something is not right, and I asked him to go have an HIV test. And then when he returned, as per my suspicion, unfortunately he was HIV positive. So it depends what you want. As a dentist, if you look at all the other professions, your position is one of privilege because you get to be the first point of contact with more than 70% of the diseases that we have. They will manifest first in the oral cavity. And you get to be the first one to see it and help the patient. That's one of the great things that you do. Again, if you look at situations where you get a baby born with a cleft lip or palate. Now, if you look at the specialists that are there, there's very few people that can touch in that territory. And again, even from a parent's perspective, it can get to be quite scary. But thankfully, there's people like us, dentists, and specialties in orthodontics, which I'm in maxillofacial and oral surgery, which I've worked in. You can get help. Your child can get help. How much do you think a beautiful smile costs? 10 rand? 100,000? We don't know. But it's things that are God-given. And the people placed in those positions to try and correct that are ones of privilege. So it's really your choice. You can be a pilot, or you can be a dentist, you can be a medical doctor. There's a big debate when it comes to that. I've got a friend who's a medical doctor. He just passed his primaries and is becoming a registrar in neurosurgery. And we joke around a lot, and I told him, I'm like, see, now you're seeing the light because you're starting to work with the most important part of the body, which is the head and the neck. You can do with legs, half a leg, but you can't do with half a brain or half a smile. So, what I'd like to say is it's really upon you as a learner, as a student. Nothing can limit you as to what you want to do. But the position in which you want to assume as a productive citizen of the country and globally is upon you to say whether do you want to be a dentist, or do you want to be a pilot, or do you want to be an engineer. That situation is all yours. What you choose from there is going to define a lot in your life. And what I would advise you to choose is choose a career where it's exclusive. Choose a career that has got a lot of pedigree. Choose a career that will make you happy. Choose a career that will challenge you. And most of all, choose a career that will enrich you. When we're talking of money, there's other professions that you will make more money in, but dentistry in itself, because it's such an elite profession, you will be able to live very well. But if it's only money you're chasing, you will find it to be very, very difficult. Because first, we want people that have got a passion for people, and the money will follow. One professor of mine, I think now he's retired, Prof. Buta, said to me, follow your career and your career will take care of you. So in a nutshell, those are the words that I'd like to leave you with. Please do come, join the School of Dentistry in the University of Pretoria, and your life will be made. Thank you.